As lawmakers head into the final stretch of the legislative session, a coalition is encouraging them to expand access to health care. Legislators are working on the plan as pressure mounts to turn the issue over to the voters.
It is an issue which has been debated in Oklahoma since the federal government began Medicaid expansion several years ago. Lawmakers have often cited that if the federal government ever decided to change the 9-to-1 matching formula, it would leave Oklahoma taxpayers on the hook for increased health care coverage costs. The issue of expansion has heated up in recent days as a coalition of organizations are backing an effort to put the issue before voters. However, lawmakers still have a chance to form a plan of their own this legislative session. Supporters of Medicaid expansion want to see action either way.
We want that policy change to happen now. This is the year. We need it now. So that's the message that we want them to hear.
There has been a lot of effort put into making changes to Oklahoma's health care coverage.
And we're not just starting today. This effort has been going on a long time, so we're going to hit that crescendo, and we're going to keep it up there at that high level until that change comes, right? That's right.
Supporters believe that expanding Medicaid could be a turning point for health care in Oklahoma and to help alleviate some of the disparities in health coverage.
We have laid before us the unprecedented opportunity to make a difference in the lives of hundreds of thousands of Oklahomans, and indeed we have the moral obligation.
Over the past few years, many Oklahomans have found themselves struggling to keep up with the rising costs of managing chronic diseases and other health issues.
The cost of insulin has skyrocketed to 10 times higher than it was 20 years ago. A study at the University of Yale found out that a quarter of the people with diabetes skip doses to save money.
Many of the people who cannot afford health insurance are working adults.
The fact that most of those who can't afford insurance come from low-income working adults, from adults who just can't make ends meet.
The Oklahoma Policy Institute is one of the organizations backing Medicaid expansion. Executive Director David Blatt says the state's refusal to expand has resulted in poorer health outcomes for Oklahomans.
It has meant that Oklahoma continues to have among the very highest rates of uninsured in the whole United States. 1 in 6 adults are without coverage.
Blatt points to improvements in the states which have already accepted the federal money to expand health care coverage as a reason why Oklahoma's leaders should follow suit.
Expansion states have seen the biggest drops in their uninsured rate. Arkansas and Kentucky, which have expanded coverage, have seen 10-point drops in their uninsured rates since they expanded coverage, more than double that of Oklahoma.
Blatt also contends better health outcomes are not the only result of expanding Medicaid. It also leads to better economic outcomes.
States that have expanded coverage have less uncompensated care costs for hospitals and clinics, which can mean the difference between survival and bankruptcy. And the effects on state budgets have been minimal and in some cases positive, as dollars are freed up to increase investments in mental health and other critical services.
If leaders don't take their shot at it now, supporters have filed an initiative petition to put the issue on the ballot in 2020.
Our legislature and our governor need to understand that they have a final chance to do their job. And if they don't, the people deserve the chance to decide this issue on the ballot.
Any plan must work for those who are working but cannot afford health insurance.
We're open to discussing whether this should involve a straight Medicaid expansion or a plan that allows people to enroll in commercial insurance. But if lawmakers do come up with an alternative to Medicaid, it must work for the benefits of the expansion population.
Legislators on both sides of the aisle are working on moving the issue forward at the Capitol, including Representative Marcus McIntyre.
I want to tell you, now I'm in my second term. I'm the A&B Budget Subcommittee Chairman for Health in the House. And this has been on my mind ever since I was elected.
Work is continuing to bring a plan forward that a majority of lawmakers can support.
The House has been and the Senate have been working on a plan for about 1.5 years now. It's in process. Most of the details right now are embargoed until we get the support we need.
House Minority Leader Representative Emily Virgin believes the positive economic and health impacts on working families in states which have expanded should be enough encouragement for Oklahoma to do the same.
In fact, these reasons should be more than enough to get lawmakers to bring this money home. But the truth is, everyone here already knows this.
She's calling for action.
You came up here because you are ready for this state to stop talking about doing what is right and take action to do what is right.
While there is no active bill containing language to accept the federal matching dollars, many feel lawmakers could still approve a plan this session. If not, voters will be asked to sign the petition to put it on the ballot so they can make the final decision.